So today we'll be talking about asthma, and asthma is defined as a reversible obstructive lung disease characterized by inflammation and increased reactivity of smooth muscle of the airways to various stimuli. And it's reversible because the symptoms can be controlled and reversed by the use of inhalers such as bronchodilators. And there's two main categories, and those are extrinsic, which are the allergic ones, and intrinsic, which are non-allergic, and so those are unknown and they're secondary to respiratory infections. So other recognized categories for asthma include adult onset, exercise-induced, aspirin-sensitive, aspergillus hypersensitivity, occupational asthma, which includes like being exposed to metal salts, antibiotic powder, wood dust, cotton dust, animal proteins, latex-induced, emotional-induced pollen, anything like that. And so the incidence for asthma is actually pretty high. It accounts for almost 500,000 hospitalizations annually within the U.S., and 34.1 million people in the U.S. are diagnosed with some type of asthma, and 9.4% of all children have asthma. Other risk factors can either come from lack of exposure to stimulants or overexposure to cleaning agents. So you have air pollution, homes that are airtight, pets, windowless offices, and so to protect against allergic sensitization, you should it recommends early exposure to stuff like pets, and to avoid other triggers.
So this is now a flow chart of asthma. So there's some precipitating and predisposing factors, which the precipitating ones have to do with environmental, atmospheric, allergens, or exercise or stress that are put on the person. And then predisposing factors would be genetics, race, age, or gender. And those go into the whole situation. And then the whole asthmatic attack starts with a trigger, which can be any of the things that the person is sensitive to, whether it's exercise or dust. And then from there we go into airway inflammation, which starts a whole inflammatory response, which you can see up in the corner, and that has to do with the IgG antibodies and the dendritic cells which notice this antigen, and then they notify the mast cells, which produce histamine, which leads to airway smooth muscle constriction. And then the T cells are also a big part of this inflammatory response with the cells that they release. So then there's three main things that occur from the airway inflammation. So that would be the hypersecretion of mucus, airway smooth muscle constriction, and swelling of the bronchial membranes. And then those three factors go into kind of two things that go together, but they lead to different things. So the narrow passages lead to the symptoms that are big in asthma, which would be the wheezing, coughing, breathlessness, and a tight chest. And then airway resistance can start cascades that can lead to hypercapnia, respiratory failure, and hypoxemia. And then this picture over in the corner is a picture of the lungs, and it's zoomed in on the bronchioles, because this is where the asthmatic attack happens. So the green over there is the airway smooth muscles, and from this response they constrict and they get bigger, and they decrease the lumen, which decreases the amount of air that's allowed in. And then the mucous membrane is also inflamed in this response, so that gets bigger and further decreases the lumen. And then there's mucus secreted, which leads to the wheezing, and then that happens too, which further goes into the small lumen. And in relation to inhalers, there's the acute inhaler or the rescue inhaler, which works on the airway muscle constriction and relaxes those muscles to allow for a bigger lumen. And then if you take an inhaler every day, that goes towards the mucous membrane inflammation and just decreases the size of that blue area over time, which allows for the person to have a more normal airflow.
So asthma is an obstructive disease, meaning that people with it have a decrease in the flow rate at which the air is inspired or expired, But people with asthma have trouble getting air out, so they have difficulties with expiration. If they are not exposed to a trigger or not in a flare, they could have a normal pulmonary function test, and then it would look like the one in the black. But that's only if their asthma is controlled. So when looking at a pulmonary function test or spirometry, there's 3 values that we specifically want to look at. So the FEV1 is the amount of air expired in that first second. So with people with asthma or obstructive disease, they will have a decrease to less than 80%. Another value we look at is the FVC, which is the forced vital capacity. So that's the maximum volume of air that's forcefully exhaled after you take the biggest breath in. So people with asthma, this will also be decreased. And then the last value that we look at is the ratio of the 2 values. So people with obstructive disease, this is decreased to less than 70%. So over time with the repeated attacks, this can cause airway remodeling, chronic air trapping, proliferation of submucosal glands, and hypertrophied smooth muscle. So this could result in COPD, which is shown up there in the red. So 3 main symptoms that we want to watch for with COPD would be a cough, excessive production of sputum, and then shortness of breath at rest. So for COPD, the values would be the same, but it would just depend whether it be reversible or not with an inhaler or a bronchodilator.
Okay, so ways that asthma relates to our top 20. One way it can relate is that it can cause angina while you're experiencing asthma, so that tightness in the chest can be interpreted as pain. Another thing is that if you have asthma or if you're taking asthma medications, you can have a higher risk for cardiovascular events like a heart attack or a stroke. With asthma, you're going to have a decreased ability to move air, as was previously talked about, and you're going to get a ventilation perfusion mismatch that can eventually lead to respiratory acidosis due to a retention of carbon dioxide in the lungs. And then when it comes to the oxyhemoglobin dissociation curve, you're going to get a shift towards the right, so you're not going to have as good of a buffer system with that. And then an alteration in the breathing pattern that you can see with asthma is that your exhalation time is going to take a lot longer than your inhalation.